Hello, my name is Dr. Swati Kulkarni. I'm a breast surgical oncologist at Northwestern Memorial Hospital. I wanted to talk to you today about what you can expect if you've recently been diagnosed with breast cancer and have made an appointment to see a breast surgeon. The first thing that happens before your visit is that the surgical team will review your breast imaging. This may include mammograms, ultrasounds, and MRIs. They will also review the pathology results from your core needle biopsies. When you arrive at your appointment, you'll be asked about your medical history, any family history of cancer, and you'll also undergo a focused clinical physical exam. Based on this information, you'll receive treatment recommendations. The majority of patients will undergo surgery as their first treatment for breast cancer. There are two main types of surgery for breast cancer. The first type is called a lumpectomy, which is removal of the tumor in the breast with a rim of normal tissue. A lumpectomy is an outpatient procedure. Now, if your cancer was found on a screening mammogram and you can't feel it, you'll need to have a guide wire or localizing seed placed in the breast by a radiologist before your procedure to help us find the tumor on the day of surgery. After the tumor is removed, it's sent to the pathology lab for testing. It usually takes about a week to analyze all of the tissue. Many surgeons will actually rearrange the tissue to close the defect in the breast after the tumor has been removed. This is called oncoplasty, and it allows us to preserve the shape of the breast. Now, lumpectomy is oftentimes combined with radiation therapy, and together these two treatments are called breast-conserving therapy. The second type of surgery for breast cancer is called a mastectomy. A mastectomy is removal of all the breast tissue. There are three types of mastectomies: simple mastectomy, skin-sparing mastectomy, and nipple-sparing mastectomy. After the breast has been removed, breast reconstruction can be done as part of the same operation. A mastectomy can either be an inpatient procedure or an outpatient procedure. Now, I often get asked if mastectomy is better than breast-conserving therapy. The outcome is the same for breast-conserving therapy and mastectomy. More surgery is not necessarily better. The recommendation for one type of surgery over another has more to do with the size of the tumor compared to the size of the breast and whether there are multiple tumors in the breast. Now, as part of breast surgery for breast cancer, the lymph nodes from the armpit are removed and tested. If tumor cells have not been found in the lymph nodes before surgery, a sentinel lymph node biopsy is performed. A sentinel lymph node biopsy generally involves a separate incision in the armpit and an injection of a radioactive tracer or a blue dye to help identify the first lymph nodes that drain the breast. These lymph nodes are then removed and sent to pathology for testing. The information that we learn from removing lymph nodes can help guide treatment options after surgery. Now, for patients with certain types of tumors, we do surgery after the patient has received chemotherapy to shrink the tumor in the breast and in the armpit. This allows us to do breast-conserving therapy instead of mastectomy for some patients, and sentinel node biopsy instead of an axillary dissection, which is a more extensive surgery in the armpit. It also allows us to see in real time that the chemotherapy is effective in treating the tumor. Now, there are two final points I wanted to discuss. If a woman has a strong family history of breast cancer or other cancers such as ovarian cancer, we will recommend that the patient undergo genetic counseling and testing before surgery. The results of this testing could impact surgical planning, so I recommend that patients talk to their family to find out if anyone has been diagnosed with cancer and how old they were at the time of diagnosis. And then one final question that I get asked at almost every consultation is that whether or not removing the healthy breast in addition to the involved breast will improve outcomes. Removing the healthy breast does not reduce the chance of the tumor coming back, nor does it improve outcomes. However, there are many reasons that women choose to remove their healthy breast, and ultimately it is a personal choice for the patient. And with that, I will stop, and I hope that this information has been helpful for you. Thank you.